You know, we tend to think of our skin as just this wrapper.
Right, like a cosmetic barrier.
Exactly. It keeps the insides in and the outside out. And if there's a smudge on the wrapper, like a pimple or a rash, we just want to buff it out. We treat it like the paint job on a car.
Keep it shiny, keep it smooth.
Yeah, exactly. But what if that breakout is actually a warning light from deep inside the engine?
That's the thing. That default setting, the paint job analogy,
Right.
it's completely backward medically speaking. The skin isn't the paint job. The skin is the dashboard.
The dashboard. I like that.
Yeah.
So when the check engine light comes on, you don't just put a piece of tape over it so you can't see it blinking anymore.
Exactly. And yet that is precisely what we do with acne almost every single time. We
Yeah.
cover it with makeup, we blast it with topical creams, and we just ignore the signal.
Which brings us to today's deep dive. We're looking at what happens when that breakout is actually a distress signal from deep inside the chassis. We are talking about syndromic acne.
It's a heavy topic. We're not just talking about clogged pores here. We're talking about the skin acting as an external messenger for really serious internal diseases. We were talking bone infections, genetic mutations, and even hormonal tumors.
Yeah, and to guide us through this, we're diving into a fascinating lecture by Dr. Hassan Riyad on complex dermatology. And the central premise from his research is that the body is entirely interconnected, which sounds obvious, but modern medicine doesn't always act like it.
No, it really doesn't. We have this tendency to hyper-specialize. You see the orthopedist for your bones, the endocrinologist for your hormones, the dermatologist for your face.
But the body doesn't respect those silos.
It doesn't. And that's where the danger lies.
Yeah.
Dr. Riyad's lecture highlights this massive diagnostic gap. You have patients, mostly teenagers and young adults, walking around with what looks like just severe acne, but they're actually suffering from systemic diseases that get missed for years because no one is connecting the dots.
Just absolute tunnel vision.
Right. If you focus only on the pimple, you miss the patient. And missing the diagnosis here doesn't just mean scarred skin. The source warns it can mean permanent bone damage or missing the window to treat a life-threatening condition.
So our mission today is to decode these red flags. We want to help you understand when a spot is just a spot and when you actually need a rheumatologist or an oncologist. And I want to start with maybe the most surprising connection in the research, which is the link between skin and bone.
Yeah, this is one of the most frequently missed diagnoses. It's a condition called SIFO syndrome.
SAPHO, that's S-A-P-H-O. It sounds like a Greek island, but it actually stands for a pretty brutal acronym.
It's a mouthful. Synovitis, acne, pustulosis, hyperoscosis, and osteitis.
Okay, so that's a lot of Latin. Let's break that down for people.
Essentially, it's a condition where severe skin inflammation pairs up with severe bone inflammation. But the devil really is in the details here. The acne isn't your typical teenage scattering of whiteheads. It's usually severe, cystic, and really painful.
Right. But the real aha moment, the clue that gives the whole thing away, is where the bone hurts. Because it's not just random joint pain, is it? It's not like, oh, my knee hurts after a run.
No, it is highly specific. It targets the anterior chest wall. We're talking specifically about pain in the clavicle, your collarbone, or the sternum. Patients will complain of this deep, aching pain right in the center of their chest.
Which is such a bizarre place for a young person to have pain. If a 20-year-old goes into a clinic with chest pain, the doctor's mind goes to a muscle strain from the gym, or maybe anxiety.
Exactly. They do not think acne syndrome, and that's why the delay in diagnosis is so incredibly long. The patient goes to an orthopedist or a sports medicine doctor for the chest pain.
They get x-rays.
Right, they get x-rays. Maybe they're told it's costochondritis, just some inflammation of the cartilage. They get painkillers, maybe physical therapy, and meanwhile, totally separately, they're seeing a dermatologist for this bad breakout on their face.
And the two doctors never speak to each other.
They never speak. The orthopedist doesn't look closely at the face, and the dermatologist doesn't ask about chest pain. But biologically, it's the exact same fire burning in two different places. It's an autoinflammatory runaway train where the immune system is attacking the bone lining and the skin simultaneously.
The stats on this from the lecture are just startling. The source notes that up to 15% of severe acne cases might actually be syndromic.
Which is huge.
Yeah, 15%. That's not some rare mystery case you'd see on a TV medical drama. That is a significant chunk of people with severe acne who are actually dealing with systemic disease.
And the real tragedy is that standard acne treatments, your retinoids, your antibiotics, the fancy face washes,
They don't do anything.
they are completely useless here. You are essentially trying to put out a forest fire with a water pistol.
Because the driver isn't a clogged pore or localized bacteria, it's the entire immune system.
Exactly. These patients need heavy hitters. They need biological drugs, things like TNF blockers or JK inhibitors. These are the serious medications we use for rheumatoid arthritis because it's an inflammatory disease, not a skin infection.
So if you have severe acne and your collarbone hurts, you don't need a facial, you need a rheumatologist.
You absolutely do. Catching it early prevents the hyperostosis part of that acronym, which is the actual thickening and fusing of the bone. You have to stop that before it causes permanent damage.
Wow. Okay, moving from the bones to the genes, the picture actually gets even more intense. The source dives into a genetic component that goes way beyond, just saying my dad had bad skin. We're talking about hereditary syndromes like Papillon,
Papier syndrome, pyogenic arthritis, pyoderma gangrenosum, and acne.
another acronym.
Right, and this one is genetic, specifically autosomal dominant. That's medical speak for saying it runs vertically in families. You see it in the grandparent, then the parent, then the child. It just marches right down the family tree.
I really want to zoom in on the middle part of that acronym, the pyoderma gangrenosum, because the source describes this in a way that makes it sound like a diagnostic chameleon. Honestly, the name sounds like a horror movie villain.
And it behaves like one.
Mm.
Pyoderma gangrenosum is incredibly deceptive. It usually starts as just a small pustule, maybe a little blister, but then it rapidly explodes into this massive, painful ulcer. The classic textbook description is an ulcer with undermined blue or violet borders.
It looks angry.
It looks very angry.
And because it looks like a rotting open wound, everyone's immediate assumption is that it's an infection.
Exactly. It looks exactly like a terrible staph infection or a bad spider bite. And here is where the trap snaps shut on both the patient and the doctor. A patient will come in, and they aren't lying. They'll say, hey, I bumped my shin on the coffee table, or I got a little cut at the barber.
But it won't heal.
Right.
Mhm.
Now that tiny nick has turned into a crater.
So the doctor, thinking it's an infected wound, does what doctors are trained to do. They debride it. They try to surgically cut out the dead tissue to clean it up.
And that is a catastrophic mistake. These wounds are sterile.
There's no bacteria at all.
None. It is purely the immune system attacking the skin. If you take a scalpel to it, you are creating more physical trauma. And in these specific patients, trauma is the trigger.
There's a specific word for this phenomenon in the lecture, right? Pathergy.
Pathergy, yes. Normally, when you get a cut, your body rushes resources to heal it. In pathergy, your body rushes to attack it. So by cutting the wound to clean it out, the surgeon essentially pours gasoline on the fire. The ulcer gets exponentially worse, specifically because of the surgery.
That is just a nightmare scenario. You go in for a minor procedure to clean a wound, and you wake up with a massive expanding ulcer because the underlying genetic syndrome wasn't recognized.
It really reinforces why taking a full patient history is so vital. You have to look at the pattern. Acne plus joint destruction plus these strange wounds that explode when you touch them, that's not bad luck. That is a systemic syndrome.
And the lecture mentions a few other variants too, like PSH and PAPAC.
Yeah, these variants involve hidradenitis suppurativa, or HS. Those are the severe recurring boils you usually see in the armpits or the groin. It's just another vital clue. If you see severe acne on the face and painful boils in the armpits, you are dealing with systemic inflammation.
Right. The takeaway really is recognizing those patterns. Acne plus boils plus joint pain equals a systemic issue. The skin is just the visible tip of the iceberg.
Perfectly said.
Now, speaking of things bubbling up from beneath the surface, we have to talk about hormones. And not the typical, oh, I'm stressed out and ate too much sugar kind of hormones. The source gets into some really serious territory here. We're talking about tumors.
Yeah, this is where that dashboard light we talked about turns a very bright, urgent red. We all accept that puberty involves normal hormonal shifts, which cause acne. But there is a very distinct line between a natural shift and a hormonal storm.
And the clinical term the source uses for that storm is virilization. This is specifically a massive red flag for women and children who suddenly develop acne.
Correct. If an adult woman comes in with a sudden, severe onset of acne, that's one thing. But if that acne is accompanied by virilization, meaning male pattern physical changes, a deepening of the voice, male pattern balding, sudden rapid muscle growth, you have to stop immediately and ask, where are these androgens coming from?
Because a simple pimple doesn't make your voice drop an octave.
It doesn't.
Yeah.
That requires a massive, unnatural surge in testosterone or DHEA. And very often, the source of that surge is an androgen-secreting tumor on the adrenal gland or the ovary.
So the acne is essentially the fire alarm for a potentially life or death tumor?
It is.
Yeah.
And there are really tragic cases in medical literature where these early warning signs were just dismissed as cosmetic issues for months. Patients were given creams while the tumor was allowed to grow or even metastasize. The skin was screaming that the hormonal balance was off the charts, but nobody listened to the whole picture.
That's terrifying. There's another hormonal condition mentioned in the source that creates a very distinct, almost unbelievable visual marker, acromegaly. This is essentially the giant condition, right?
Right. It's caused by excess growth hormone, usually from a tumor on the pituitary gland in the brain. The classic signs are that the patient's extremities grow larger, they'll tell you their wedding ring doesn't fit anymore, or they've suddenly gone up 2 shoe sizes in their 40s.
But the skin sign, the acne connection, is wild.
It's unforgettable once you see it. It's called cutis verticis gyrata.
Cutis verticis gyrata, which the source basically translates to brain scalp.
It's a startling visual. The skin on the scalp actually thickens and folds over on itself. It creates these deep ridges and furrows. It literally ends up looking exactly like the surface of a human brain, with gyri and sulci, but made of scalp skin.
So if you are looking at a patient with severe sudden acne, their hands and feet are growing, and their scalp is starting to furrow like a cerebral cortex.
You are looking at a pituitary tumor. The excess growth hormone is driving the skin cells and the oil glands to grow completely out of control. The acne is just a byproduct of the whole body being forced into overdrive.
And sticking with that overdrive theme, the lecture covers a condition that hits teenage boys very specifically, acne fulminans. Just the name alone sounds explosive.
And it is. It's highly explosive. This is not just a bad breakout. This is a full-blown systemic emergency. It usually hits teenage boys right around ages 13 to 16, right in that peak window of their growth spurt.
Right.
They develop this sudden ulcerating acne that turns into open bleeding sores.
Mm.
But they also have high fevers, severe bone pain, and their white blood cell count goes right through the roof.
Which sounds exactly like a massive infection.
It mimics sepsis perfectly, but it's actually an extreme immune reaction to their own testosterone surge combined with the bacteria on the skin. It's a perfect storm. The high testosterone drives the rapid bone growth and the acne simultaneously.
So what happens if you just give that kid a standard acne cream?
They will get worse. They're systemically ill. They often need systemic steroids and highly specialized care to calm the entire immune system down before you can even think about treating the actual acne.
Wow. Okay, so we've covered the body attacking itself, we've covered genetic syndromes, and we've covered tumors. But there's a really fascinating paradox in Dr. Riad's lecture regarding medications. Sometimes the acne isn't a sign of a disease, it's actually a side effect of the cure.
Yes, drug-induced acne, or, to be technically accurate, acneiform eruptions.
What's the distinction? Is it just medical semantics?
No, the biology is fundamentally different.
Sure.
True acne is polymorphic. You have a messy mix of blackheads, whiteheads, little red bumps, big deep cysts. It's a diverse ecosystem.
Right.
Drug-induced eruptions are monomorphic. They are clones. Every single red bump looks exactly identical to the one right next to it.
And the source points out a crucial difference.
No comedones. There are no blackheads or whiteheads in a drug eruption.
So if you see a rash that looks surprisingly uniform, almost like a wallpaper pattern, and it's in odd places like your forearms or lower back, that's a huge clue that is coming from an external chemical, not your pores.
Exactly. And the most fascinating and kind of counterintuitive example of this involves cancer treatments, specifically drugs called EGFR inhibitors.
Which are used for things like colon or lung cancer,
Right. Now, EGFR stands for epidermal growth factor receptor.
which sounds like something very important for your skin.
It's vital. It literally tells your skin cells how to behave and grow normally. But many aggressive cancers hijack this exact receptor to grow out of control. So oncologists give a drug to block it.
Which is great for stopping the cancer.
It's brilliant for the cancer. But the drug also blocks the normal receptors in the skin.
So the skin just goes absolutely haywire.
It creates a severe, extremely painful acne-like rash in up to 80% of patients on these drugs. And psychologically, you can imagine this is devastating.
I mean, yeah, you're fighting for your life against cancer, and now your face and chest are covered in these painful, identical bumps. Patients must just want to immediately stop the medication.
They do. It's the most common reaction. But the research shows that stopping the drug is the wrong move.
Because of the paradox.
Right. The rash is actually a robust surrogate marker for survival.
Meaning the rash is a good sign.
It's an excellent sign. It means the drug is actively working and hitting the target receptors perfectly. The worse the rash on the skin, statistically, the better the cancer prognosis.
That is such a heavy psychological burden to place on a patient, but also weirdly hopeful, like having to look in the mirror and tell yourself, this awful rash means I'm winning the fight.
It takes a lot of coaching. Our strategy is never to stop the cancer drug. We treat the rash aggressively with oral antibiotics like doxycycline or topical steroids, but we keep the pedal down on the chemotherapy.
And it's not just cancer drugs that do this, right? The lecture mentions a few other culprits that cause these acneiform eruptions.
Oh, many. Steroids are a classic one. You see bodybuilder acne from anabolic steroids or patients on high-dose medical steroids for organ transplant.
The source also called out JAK inhibitors.
Yes, this is a newer phenomenon. JK inhibitors are great new drugs for arthritis or severe hair loss, but they are now causing a very specific type of monomorphic breakout we've nicknamed JACNE.
JACNE. Very creative.
Dermatologists love a good portmanteau. And it can even happen with over-the-counter stuff. High doses of vitamin B12 or psychiatric medications like lithium are known triggers too.
Okay, before we wrap up, we have to address the elephant in the room, or rather, the French fry in the room.
Diet.
Diet. Everyone listening wants to know, did I eat my way into this breakout?
It has been the most controversial topic in dermatology for decades. For years, doctors confidently told patients that diet doesn't matter at all. Eat whatever you want.
But the pendulum has swung back.
Hard. The current data points a very accusatory finger, but not just at sugar or chocolate. It's about insulin resistance, and the source specifically calls out public enemy number one.
Hydrogenated oil.
Yes, the processed vegetable oils, the corn oils, the cheap stuff used in commercial deep fryers.
So the lecture literally calls out glistening fried foods.
Exactly. Glistening is the warning word. The working theory is that when you consume these highly oxidized processed fats, they actually integrate into your own cell membranes. They make your cell walls rigid.
And when the cell wall is rigid, the insulin receptors on the outside of the cell don't work well.
Right, you develop insulin resistance.
So because your body isn't processing insulin efficiently, it panics and pumps out even more insulin to compensate.
And that insulin spike is the trigger. High insulin levels systematically stimulate something called IGF-1, or insulin-like growth factor. And IGF-1 is basically miracle grow for your sebaceous glands. It commands them to grow larger and pump out massive amounts of oil.
So eating the greasy French fry doesn't directly put grease in your pore. It breaks your cellular metabolism, which then forces your body to explode your skin from the inside out.
It's a systemic inflammatory loop, exactly like the bone syndromes we talked about earlier. It's all connected.
And the lecture touches on how to flip that switch back, right?
Yeah.
It mentions the microbiome and ketosis.
Yeah, this is fascinating. We have billions of bacteria on our skin and in our gut, and many of the bad actors thrive on a high-sugar, high-carb diet. They love it.
So what happens when people fast or go into heavy ketosis, cutting their carbs below 50 grams a day?
The bacterial population changes completely. You literally cut the supply line. The bacteria that feed on sugar starve to death and die off.
Which clears the acne.
For many people, yes, because you've starved the bad actors. It's a profound shock to the system. It really proves that our skin isn't just a surface. It's an ecosystem. If you change the soil, meaning the nutrients in your blood, you fundamentally change the plants that grow on the surface.
That is a very holistic view, and honestly, it feels really validating. People aren't crazy for noticing that their diet affects their skin. The biochemical mechanism is absolutely real.
It's very real, and it's powerful.
Well, we've covered an immense amount of ground today, from chest pain to brain scalps, cancer drugs, and insulin spikes. So let's try to condense this for the listener. If you're looking in the mirror today, what is the ultimate engine checklist? What are the red flags that mean you need to stop buying face wash and go see a specialist?
Let's boil it down to 5 non-negotiables based on the source material. Red flag number 1 is age.
Age.
If you get severe acne for the very first time after age 25, that is metabolically suspicious. Teenage acne is normal. Adult onset severe acne is a signal.
Okay, so adult onset.
Number 2 is speed. If the onset is explosive, meaning you go from completely clear skin to severe ulcerating lesions in a matter of weeks, that is a systemic emergency.
Let's say age and speed. Got it. What's the third?
Number 3 is deep pain. If you have acne accompanied by severe joint pain, specifically in the chest or collarbone, or if you have bone pain and a fever.
Like the SEPO syndrome or the acne fulminans we discussed.
Exactly. Number 4 is uniformity. If the rash is monomorphic, every single red bump looks exactly the same, and there are absolutely no blackheads.
That's the one where you need to check your medicine cabinet.
Right. Look at your medications, your supplements, your B12. And the final one, number 5, is virilization.
The hormonal chaos.
Any sign of severe hormonal shift alongside the acne. So hair loss, voice deepening, unexpected muscle growth, that requires an endocrinologist immediately to rule out a tumor.
It is so empowering to have that list. It really turns a kind of vague anxiety into an actionable checklist.
That's always the goal. Knowledge is the antidote to fear in medicine.
You know, we started this deep dive by talking about the mirror. And looking at all this evidence, I think the biggest takeaway is that we need to fundamentally change our relationship with our reflection. We need to stop looking at our skin and start listening to it.
That is perfectly put. The skin is the only organ in the human body that is completely visible to the naked eye. It is constantly broadcasting the real-time status of your internal health. If that dashboard light is blinking, don't smash the bulb.
Don't just paint over it.
Look under the hood.
Because that blinking light might just be the ultimate translator for your body. It might be trying to save your life.
It just might.
Well, thanks for taking this deep dive with us today.
Always a pleasure to be here.
Keep listening to what your body is telling you, and we'll catch you on the next deep dive.